Manisha Bhattacharya, and I am in year 5 of 6 of a dual degree program here at Duke. I'm doing both a medical degree and an MBA from the Fuqua School of Business. When I was looking for a graduate school, I wanted to go somewhere where I could both study medicine and potentially study business. And so that's why I chose Duke. Duke had a really strong health sector management program, but also had the Global Health Institute. And so I thought that I'd be able to combine this very interdisciplinary approach to studying questions in global health using this toolbox from the MBA of understanding why private sector entities make the decisions they do and give us the health system we have. So when I got here, I started medical school and started to try to get involved in DGHI. And early on, I joined the student council. I got to represent the medical school and then eventually also the business school, and talk to others about how to improve global health at Duke. It's been really amazing to see how using resources from all of the university and putting together pieces of what I learn in the classroom and the types of opportunities that are open for students to do global health research, I've been able to actually put all of this interdisciplinary learning into practice. Halfway through my MBA, I started to talk to DGHI about this idea that I had for a research project. I was very interested in studying cancer care worldwide, cancer being an area of increasing importance in low and middle income countries, and it's an area of medicine where the infrastructure is really lacking in a lot of places. And so I wanted to take an integrated approach that was both clinically based and business based to study the current state of cancer care infrastructure and to understand what practitioners on the ground thought needed to be done to improve their ability to take care of their cancer patients. And so I came to DGHI and I said that I have some preliminary leads to do this kind of work in India. It's a place that I understand well as far as regulation and policy in the current healthcare system. And I have an advisor who's willing to take me on, and what do you think? How can I put this together? And I was really so happy that DGHI showed so much enthusiasm for the project, and I applied for a medical student grant and received one to do this work. And so I was able to speak with a lot of faculty members in helping to design my project, and spend about 3 months in India on the ground, and that was a really transformative point for my career. Now that I'm back from that trip and starting to do further work in helping not only work in global cancer in India, but also work with others at Duke who are interested in furthering our footprint in global cancer, it's really exciting to connect the traditional global health thinkers with some of the thinkers in social entrepreneurship that are elsewhere in the university, and some of the thinkers that are working on health services research, cost of care, infrastructure design, and see where we can take that together as a new facet of global health. The education that I've received here has been tremendously helpful. There are a lot of really bright people here at Duke who have been so interested in what I've been working on. Continuing to learn from them is a big part of improving my ability to then take that forward. And then certainly all of the support from DGHI for doing my actual fieldwork in India, that was a tremendous pivot point in my career. I'd been wanting to do this kind of interdisciplinary study for at least 10 years before I got here. I mean, this has been something that's been really personally important to me, to have the institutional backing to do something that no other faculty member was doing exactly. That was huge for me, and I'll always look at that as a really pivotal moment in my career that was possible because I came to Duke.